Doctors will advise it very casually at the drop of a hat. Oh, you're a little old, your egg quality is not very good, your AMH level is a little low. I think it's very important that patients understand that this is a decision which they need to make for themselves. Many patients with poor ovarian reserve find themselves in a dilemma. Should I keep on trying with my own eggs or should I consider using donor eggs? How many cycles should I do with my own eggs? And when do I call it a day? Now, the decision to use donor eggs is extremely difficult. Doctors will advise it very casually at the drop of a hat. Oh, you're a little old, your egg quality is not very good, your AMH level is a little low, the antral follicle count is a little low. Yes, we're getting eggs, but the embryos aren't very good. So why don't we just go ahead and use donor eggs? Very easy for a doctor to say this. Very hard for a patient to accept. After all, when you want to have a baby, you want the baby to have the color of your eyes and your hair and obviously your DNA. That goes without saying. So it's not a simple thing, oh, fine, if this blue shirt doesn't fit, let's just wear a red shirt. Unfortunately, doctors can be remarkably unempathetic and unkind and uncompassionate, and they don't understand what the patient is going through. And it's very easy for them to say, fine, if this doesn't work, let's just use this. I think it's very important that patients understand that this is a decision which they need to make for themselves because they're going to have to live with the consequence of that decision, not the doctor. It's very easy for the doctor to give advice, but the doctor doesn't need to live with that baby for the rest of their life. So you need to provide your own inputs, your own preferences. You need to have a plan of action where you hope for the best and you prepare for the worst. If you own the decision for yourself and you choose to use donor eggs, you'll be a great mom. But if you choose to do donor eggs because your doctor pressurized you to doing it because your egg quality wasn't great, then you'll be extremely unhappy. And not only will you make your life miserable, you mostly end up making the kid's life miserable as well because it wasn't your decision.